Our next session is all about empowering the patients, how to make informed decisions in glioblastoma treatment. In the landscape of treatments, it may be hard to decipher what treatment is right for you. We reviewed a lot earlier, but what is right for you? In this session, you will gain insight into key considerations when evaluating treatment benefits and side effects. Our speaker, Dr. Alyssa Thomas, is a neurologist and neuro-oncologist at the University of Vermont Medical Center in Burlington, Vermont. She provides clinical care for patients with primary and metastatic brain tumors and leads the Brain Tumor Clinical Trials Program. Dr. Thomas's goal is to improve quality of life and treatment outcomes for patients and families who are living with brain tumor diagnosis. She has a special interest in care for patients living in rural areas. She also serves as the neurology residency program director and is very involved in neurology and neuro-oncology education. Dr. Thomas is also the current vice chair of neuro-oncology section at American Academy of Neurology. And if you have seen her answer questions on platforms like Roon, you may have noticed that she has a special warmth to her interactions. I can attest that she was quite influential for me personally to choose neuro-oncology as a career many years ago, and I have no doubt she will have hands in shaping many other physicians' lives in choosing neuro-oncology. Please welcome Dr. Thomas.
Dr. Thomas, you have control of the screen. Feel free to click the slide.
All right, thank you so much.
Of course.
Dr. Umamura, thank you for that kind introduction, and thank you to the ABTA for inviting me, and to so many people who are here live today. This is amazing to see what a community come together. So I'm really excited about this topic. I was looking up on Google and in the Oxford Dictionary about empowerment, and empowerment is really a process in which we become stronger and more confident in controlling our own lives. And so over this next session, we'll talk about how decision-making for glioblastoma can help you to feel more informed and hopefully have confidence that you have the power to make decisions that are best for you. So these are my disclosures. And our learning objectives for this session are to understand how to evaluate treatment options and make decisions that align with your goals and preferences, to learn how to navigate the process of informed decision-making in the context of brain tumor treatments, and to gain tools to feel empowered and confident in your treatment choices, balancing risks and benefits and quality of life. So as we start, I just want to recognize that having a glioblastoma is hard. Any health problem can be really challenging to navigate, but a diagnosis of a relatively rare cancer that affects your brain can be particularly emotional. And decision-making related to your care and treatment is complicated, both due to the medical complexity of glioblastoma itself, the complexity of the treatments that we're discussing, and because there isn't always one right answer. And so decision-making in this disease in particular is not always straightforward. And at many junctures during your treatment, you may hear there's more than one right choice that might be reasonable without a clear right or wrong path. And so our goal today is really to think about how to empower yourself so that you can make the best decision you possibly can for yourself based on the information that you have at the time. One thing that I think is really helpful before thinking about all of the little details of each treatment, risks, benefits, side effects, logistics, and so on, it can be helpful to sort of take a step back and consider your why. Why are you considering this treatment in the first place? And often the reason we think about seeking medical care and going through cancer treatment is because we're trying to preserve or achieve something that's really important in our lives. And so I encourage you to take a moment and just think about what are the things that you value most. For some people, it may be time with friends and family. It may be your spiritual well-being. It may be your cognitive functioning. It may be your physical functioning. For some people, it may be longevity, others independence, sometimes pursuit of happiness. There are likely to be moments during your treatment where either consciously or subconsciously you think to yourself, why am I doing this? Or why should I be considering this? And sort of having this big picture either in the back of your mind or maybe right at the front, written in a journal or written in a notebook that you keep, can help you to decide, is this next treatment in alignment with the things that you value most? And so if the answer is in alignment, for example, if this treatment is going to extend your life and longevity is a high priority, that may be a really easy yes for you. But then if it's out of alignment, that also might help you to say no, right? So if there is a treatment, say for instance, a surgery that may impair your physical function and physical health is really important, that might help you to balance those risks in that decision making. So we're going to take the next few minutes to think about the who, what, where, when, why, and how of decision making. And this is just to try to create some sort of framework to help you to evaluate your choices. So when I think about who in treatment decisions, I think about who is giving you that information and who's helping you to navigate decisions. There are a lot of who's on your treatment team. Often central in your treatment team is either your neuro-oncologist or your medical oncologist. That's the person who prescribes and manages chemotherapy, and usually also the person who is evaluating your MRI scans, helping to make a judgment about whether a treatment is working or not working, and really giving you a lot of information as your primary point of contact as you're navigating treatment decisions. Your neurosurgeon is the person who performs the brain tumor resection or removal, or does a brain biopsy, helps navigate any surgical decisions, and also helps to navigate surgical complications. Your radiation oncologist is the person who plans and delivers radiation therapy and helps navigate radiation side effects. You likely also have a primary care doctor who can help you manage all of your other medical diagnoses. You may have known you for a long time, both before and during your brain tumor diagnosis, and so helps you to figure out how your cancer care fits in with your overall health. And you may have a palliative care physician who helps you navigate symptom management and alignment of your treatment with your goals. And these are just the people on the physician side of your medical team. You may also have a number of nurses, nurse navigators, nurse practitioners, physician's assistants, and others who are on your care team formally in the healthcare setting. And then the other who are your people? Who's your personal support system? And it can be helpful to identify the people who you really want to most closely involve in your medical care. So is there someone you want to bring to your appointments with you, or someone you want to discuss treatment options with, someone you want to have access to some of your healthcare information? For many people, this might be a caregiver, could be a family member, a spouse or partner, maybe a child or a close friend. Some people like to keep their circles really small with only a couple of people, and others like to have a whole lot of people involved in their healthcare. But knowing your who can really help you to have a sounding board and someone to reflect with as you're making decisions. The what is really the treatment modality, and there are a lot of different kinds of treatments as you heard about in the first section of today's talk, but this includes chemotherapy or other systemic therapies like immune therapies, radiation therapy, surgery, device therapies like the Tumor Treating Fields device, clinical trials, symptom management, so medications that are designed to treat seizures, treat headaches, other supportive care interventions like physical therapy, and then supportive care like having therapists, counselors, nutritional support, medications, and supplements. So where you're going to get most of your care. And it can be really helpful as you're deciding about treatment to understand what both your local and regional treatment options are. ABTA has a really nice resource, and I put a screenshot here and the web address at the bottom that can help you to identify treatment centers near you. It's helpful, I think, to consider at the treatment center, are there people who know glioblastoma? Are there doctors there on the staff who are familiar with this diagnosis and know how to treat this disease? Do they have a whole treatment team? So all of those other people, surgeons, radiation oncologists, are those within one facility, or will you have to go to more than one facility to be able to interact with all the different component people on your treatment team. And it's important to consider, how far are you willing to travel? What did that mean for you and your family to get care in your local community or to be far away from home? And then the other piece of the where, when you're weighing whether or not to pursue one treatment or another, may have to do with where you actually have to get that treatment. Is it a treatment that you can do from home? Do you have to be in the clinic for it? Do you have to actually be admitted to the hospital? And how much time does that mean for you being in and out of the healthcare system? So when in facing your treatment decisions has a lot to do with how much time you have to make a decision. Everything in glioblastoma often feels urgent, right? Because this is your brain and this is your health. But there are many things that, while they're time sensitive, are not necessarily emergent. And often taking a moment, whether it is asking for a couple of days, asking for a few hours, but just taking some time to process the information that's been given to you, discuss it with with your people, and then come back to your doctors with a decision, can be really helpful to make sure you feel confident that you thought this through in a way that lets you make the decision that's best for you. And you should know that you don't have to change, that you can often change your mind, right? Decisions in treatment making are often revisited. So it's helpful to ask your doctors, when are you going to reassess this to see if things are going as expected? And would you have an opportunity then to change your mind if things are not going according to plan? We talked a little on the very first slide that I showed you about finding your why. But there are some questions that you may want to ask your doctor about why you would consider a certain treatment. Will it make you feel better? Will it make you more independent? Will it help you to live longer? Will it help prevent other complications? Asking these kinds of why questions should help to give you more of the information you may need beyond risk, benefits, and side effects. And then the how. So the how questions I would consider when you're evaluating a treatment decision. Some of the really important questions, such as, how is this going to make me feel? How will this affect me? And how will I know if it's working? So as you take this who, what, where, when, why, and how, we're often holding things in balance, thinking about the things that are most important to you in your life, and then balancing those with what is the reality of this treatment and how is that going to make you feel. There may be times where the things that are of personal importance to you make the risk of treatment more worthwhile. And may be other times where treatment may seem riskier to you without giving you that same benefit. And in many ways, you're the person who'll be able to make that value decision best based on what's really important in your life. And so as you reflect on each treatment decision, um, these two questions I find can be really important at each new juncture. So you'll be making decisions when you're newly diagnosed, when you've been living with glioblastoma for a while, when you're facing a recurrence, when you're facing end of life. And at each of these new phases, it can be really helpful to pause and ask yourself, what am I hoping for in this phase of my care? And what am I most worried about? These answers may shift over time, and it's okay to take a pause and just think about, what are your shifting goals at this phase with your disease. So for the next few minutes, I'd like to just talk about some very practical tips for navigating decision making. One thing that is going to be essential is communication with your team of doctors. You want to have a partnership with your doctor so that you can get the most out of every visit and that they can share with you all of the information that they have available. So it's really helpful to prepare for your appointments to ensure that you get what you need from your time together. Preparation may mean bringing someone with you who can listen and take notes and support you. It may mean writing your questions down ahead of time so that you don't forget something that's really important to you when you're in the moment and the appointment becomes busy or things get delayed or you're feeling overwhelmed. Having those questions written down will ensure that you're not going to forget to ask the thing that you wanted to know. Some of the questions you may want to ask are, what are my treatment options? What are the risks and benefits of each of these treatment options? What would happen if I chose not to do this treatment or chose no treatment? And how will this affect my day-to-day life? And then the other thing that's really important in communication with your doctors is ensuring your understanding. It's okay to say if you don't understand. Some of this is really complicated, and I'll tell you, we all try to do our best to communicate in ways that make sense, but there are a lot of doctors who are trying to find the right words that are either not too medically complex, but still informative enough. And so it's okay to say, can you just explain that to me in another way so that you make sure you leave each visit really with a firm understanding and a good grasp of all the information your doctor is sharing with you. The next practical thing I would consider is, who are you getting this information from? When you're choosing your doctors, their communication style is one of the factors that's going to be really important, but there are several factors you might weigh when trying to decide if the doctor who you're primarily working with is the right doctor for you. Their experience matters, right? You want to work with somebody who has experience with treating glioblastoma specifically and feels comfortable with the diagnosis you have. Their communication style, as we mentioned, is important, and their openness to collaboration may be very important. This is a team sport, so to speak, right? And within our institutions, we work really closely with colleagues across different disciplines like neurosurgeons and radiation oncologists, palliative care doctors, but many neuro-oncologists are open to collaboration interinstitutionally. And sometimes it can be really helpful to have a primary team and a consulting team. And knowing if your doctor is okay with that can be really helpful. Availability matters, right? There's a lot of time-sensitive choices. And so it matters that you're able to get an appointment in a timely manner. And accessibility also matters. So how much do you have to travel? How close do you live to their clinic or office? Is care in their institution covered by insurance? Picking your doctor, there really are some practical things that matter to your day-to-day quality of life and interaction. And then thinking about the rest of the team. You might have a fantastic doctor in a hospital nearby. But if you don't work well with their nurse or their case manager or their parking garage or whatever it may be, these are elements that will affect your day-to-day care. And just thinking about that as you're weighing your decisions can be really helpful. I think sometimes that the interaction with the doctor is held up as primary, but knowing who your whole team is can be really important as well. I think one of the hardest things about making treatment decisions in glioblastoma is navigating uncertainty, because it's true that things are not always black and white or a yes or no answer. We're also often making decisions that are based on probabilities. So how likely is this to help you? And also on prognosis. So how serious or how medically complex are things right now? So your doctor may be able to provide you with some statistics about whether or not a treatment may be effective. There's a lot about glioblastoma care that is very unique to an individual. So no two patients with glioblastoma are exactly alike. Your age, your overall health, the location of your tumor, your ability to undergo various treatments, your personal values, these are all things that are unique to you. And so how do you decide when there isn't a clear right answer? I think some of the things to consider are, does this align with your values and the things that are most important in your life? Is it a decision you can live with, right? There may be some things that align with your values, but you're like, boy, I just can't put myself through that. And it's important that you're able to live with the decisions that you make. And then there is this element of a leap of faith. Sometimes you have two equally good treatment options, clinical trial A or clinical trial B, or chemotherapy 1 or chemotherapy 2. And it really isn't clear which one might be better for you. And so you just pick the one that seems to fit your needs at the moment and then wait and see how that works for you. And so there is a bit of an element of taking a leap of faith, making a commitment to whatever the treatment is, and then following that forward to see how things work. Navigating advice, I think, can be another really challenging thing in decision making. You are going to get a lot of well-meaning people giving you welcomed and unwelcomed and solicited and unsolicited advice. And this can be really hard to navigate. I'm sure many of you already have had lots of friends and family who reach out and say, you have to get a second opinion here, or this is the best doctor in the world, or this is the supplement that's going to make the difference for you. And it can be really hard to decide and sift through what of that information you should take to heart and what you shouldn't. I think it's very important to stay grounded in your own priorities and remember that your health can be as private or as public as you want it to be. So share only the information with friends and family that you feel comfortable sharing. Sometimes having one of those people who's one of your people filter this can be really helpful. So as people are sending you emails and sending you articles and calling with advice, having a trusted friend or family member who'll help filter some of that can help protect you a little bit so that you can sort of process the information on your own time and under your terms. And then I would say it's important to have some trusted resources. So if somebody is making a recommendation or a suggestion to you, running that by your doctors or using reliable websites and organizations like the ABTA can be really helpful to check the truth of these recommendations. And then honoring your intuition is important. If you've got a gut feeling that something doesn't feel quite right about what somebody is recommending to you, trust that and make sure that you double check it. All right, so wrapping up, what does it mean to be empowered? Empowering yourself to be your own decision maker, I hope will give you back some sense of control, right? There's so much in a diagnosis of glioblastoma that you didn't choose for yourself. But reframing treatment decisions as a place where you do have control can give you back some choice. You can choose what risks you're willing to accept, and you can decide which benefits are most important for you. And recognize that nothing is perfect, but you get to decide whether it's acceptable to you or not. Any decision you make doesn't have to be final. You're allowed to change your mind, and your decisions may evolve over time. Above all, your voice should stay central in these decisions, and making sure that you have a dialogue with your healthcare team and with the people you choose to involve in your healthcare is essential. So, wrapping up, there's no one right path for every patient. There are some clear evidence-based treatments that may be helpful. There are a lot of experimental treatments out there, like the clinical trials you heard about this morning. And really the goal in patient-centered decision-making is to find the way that is best for you, the treatment options that are most aligned with your values, and that will help you to keep at present and going on in your daily life the things that matter most for you. Know that you can change your mind if what you thought was going to work for you doesn't match what you actually experience, and allow yourself to be the center of your own care. Thank you so much for giving me the time to talk with you all, and I look forward to going through your questions.
Thank you so much, Dr. Thomas. We invite you, Dr. Mamamora, to join us for our Q&A. All right, so we have some pre-submitted questions, but feel free, audience, to start entering in some other questions for this session. So we have somebody who is currently in treatment, and they're asking the question, how much should they push themselves to do things? Kind of a quality of life question, but like, are they, they feel like they're overthinking at times while they're on their treatment. Do you have any sort of suggestions?
I do have some suggestions. I think there's an individuality to this, but the things that are important to you in your life outside of cancer, I would say are the things you should prioritize even through treatment. And so if getting some exercise is important, if balancing your diet is important, trying to preserve that during your treatment can be really helpful. I think when you're going through cancer care, listening to your own body matters a lot. It's difficult to push yourself to the point of actually making things worse in the long term, but it's easy to push yourself to the point where the next day feels pretty bad. And so listening to your body to say, okay, I've done enough for today and now I need to rest, it becomes a really important, internal reflection for yourself.
Great, thank you. Our next question here is how to make a good choice in my care when presented with several options. It was shared that oftentimes it's very overwhelming for what to choose, especially in the throes of being newly diagnosed.
Yeah, it is. It's really overwhelming. And often when your doctors are presenting you with more than one choice, it is truly that there is more than one right answer, so to speak. I think I usually will first sort of do a gut check, right? Like, if one of these things just doesn't feel quite right for me and one feels better, that matters, right? I think it also matters to think about what are the logistics. If there are two equally good options and one can be done at home and one requires you to travel 2 hours every week, that may play into your decision making. And then I do think it's okay to ask your doctor, like, what would you recommend? Understanding that you may have different preferences than your doctor. They may feel like there is an edge to one or the other that may be a better fit for you. And so soliciting their advice there can also be helpful.
Yeah, and I totally agree with that. And I would add that it does make it easier for us to have a shared gut reaction, so to speak, with you if we know our patients better. So for example, in the first meeting or second meeting, every patient and their caregivers are different or families, and sometimes they're a bit open to sharing about their lives, or they might just kind of keep it to the matter of fact. And I often ask them what they do, what they like to do. And it's not necessarily to distract them from the diagnosis, but I'm trying to, get to know them. And over time, going through MRIs, even through the chit chat, you get to know one family to the other that are slightly different. And it does help over time, just kind of understanding what that person might lean towards, let's say after, maybe their ability to communicate becomes affected over time, but I might be able to understand it a little better because I've known them for several, months or years. I think it really makes a difference in our ability to help.
Great, thank you so much. And Dr. Thomas, you alluded to this earlier, but thank you so much for recommending our treatment center guide, which really does help patients or their loved ones determine, what is a good center for them across the US. And each of those centers includes number of patients treated annually, technologies, specialized procedures, etc. So feel free to check that out, anybody. We also have a resource about questions to ask your healthcare professional. So if you're overwhelmed, you don't know what to ask, we have a guide that also helps support this. Okay, next question is how to approach decision making as a caregiver.
Yeah, that's a terrific question. And I didn't spend a lot of time on that today, but surrogate decision making is one of the most challenging areas, I think, um, because of the nature of glioblastoma. There are many patients who either don't have the cognitive awareness or the communication ability to fully make treatments for themselves. And so we're often looking to caregivers to make surrogate decisions. I think to the greatest extent that you can, when you're acting as a surrogate decision maker, if you can make the decision of what would my person do if they could make this decision for themselves, that's going to help you get to the right answer. Because we often have our own wants, right? Like when I can imagine, if I were caring for a family member, I may have my own priorities, but thinking about what this person would choose for themselves is really the role we're hoping the surrogate decision maker can get into. Surrogate decision making, I think, is um, is another layer because you're trying to act in the best interest of somebody, and you're also likely coping with some of your own emotions and maybe some feelings of grief and loss and shifting relationships. And so it can be still really helpful to have a support person for you as your person's support person, right? So there can be many layers where it's really nice for you to have a sounding board just to talk through the decision making process. And again, as Dr. Umamura was just saying, I think um, it, I think as your relationship evolves with your treatment team, they're likely to be able to give you more guidance. I often have caregivers will say to me, well, what would you do if this was your own dad? And I'll say, no, I know exactly what I would do if this were my own dad because I know my dad so well, right? Like I know what was important in his life and I can help to balance that. But I don't know your father as well. And that's why, I'm looking to you to help guide me about whether this would be aligned with their values or not.
And I would say, my usual response to that is, these are the choices I would give my parents. And, I wouldn't give an option to my patients that I wouldn't give my own family. I just don't know which one is more right for them. Another thing, I'm just realizing I did this exercise probably when I was a resident, when Dr. Thomas was a chief resident with our other residents, is an exercise of getting to know each other, even as a family or friends. Talking about what someone wants to do at the time of distress is really difficult, like Dr. Thomas said, with emotions being heightened. And you may not know your loved one as well as you might, or maybe you didn't even think about certain things, right? But unfortunately, we all get older. We all are going to be faced with decisions about what to do with health. And anyone over 18 should have advance directive. Not that we all have it, but anyone over 18 should have advance directive. You have a voice. Even if you can't speak or you're unconscious, you have a voice if you put it in writing ahead of time. And one of the things that I talk about patients who have the bandwidth to really talk about it is, around the holidays when everyone get together, make it a normalized thing where everyone, healthy or sick, sit down, look at the advanced directive, talk about scenarios, and learn about each other's preference. It is a bit of a downer of a holiday activity, but it can be very enlightening to learn about each other. You can actually talk about it a little more lightheartedly because people are doing well at that time. And those are really eye-opening experiences for a lot of families. And it does help. And you can also make sure you can help all your family members to have advanced directives in writing.
Thank you so much. Next question that we have here is how to be your own best advocate. So let's just put a scenario out there. There's difference of opinions, whether that is between the doctor, what they're recommending to do, and what the patient is comfortable with, or let's say a caregiver or their loved one really wants the patient to proceed with this treatment, but the patient is like, no, this is what I want to do. How would you give some tips or advice in this situation?
Yeah. I have a couple of tips I would give in this situation. This is a hard situation, right? Acknowledge that this is a hard situation, and it can become a very emotionally charged situation, especially if there's disagreement or pressures within family. I think being well informed is very helpful. Knowledge is power in this situation. And if there is a treatment that you're uncomfortable with, for example, and a patient or a family member is asking you to do, for you to know in your own mind, like, what is the actual benefit of this? What is the actual risk? Am I making this in the most informed way possible toward this decision can be helpful and can also sort of help you explain yourself to family if you choose to do so. I think the second thing I would say is that ultimately the decision is yours as the patient. And so regardless of the outside pressures, being able to sort of hold true to your values and sort of reflect that back on that, is this something I can live with? Is this something that is aligned with the why I'm doing treatment in the first place, will help you to be able to sort of feel more secure. And then I'll make a plug for second opinions. If there's something, especially if it is um, a difference in alignment of decision making between you and your doctor or you and your care team, or even if it is the way your family is interpreting what your doctor is saying versus how you are interpreting it, getting a second opinion with another specialist can be really helpful. Hopefully you're seeing today across the country, most of us in neuro-oncology know each other really well. Shockingly, there's not that much ego in this field, and we're really happy to say, sure, I'll refer you to a colleague in this, that, or the other place. Hear how they say it, see if the words they choose resonates with you any differently, and then and then you've heard it from two different angles, and you can kind of weigh those different options.
Thank you. Anything to add, Dr. Imamura?
No, I think she said it perfectly.
Yeah, great. Yeah, and you alluded to the next question, which was how to ask for a second opinion. Any other last thoughts for that?
I, I try to offer it before patients have to ask, and you may get that, right? And it's not because um, I feel uncomfortable in managing this disease. This is what I do all day, every day. But because frankly, it's a welcome thing for me too, right? I think if you can get into that mindset that second opinions really only help. Either they give you assurance that what you're doing is supported by another physician in another institution, so you can come back to your home institution and just have confidence in that, or they give you another option to weigh. And either of those is a positive outcome from a second opinion.
I think I can add that, specific, like if the second opinion is about like choosing what to do, I think, those are like, I totally agree that that is also what we do. I think specific to when patient ask about like where can I go for a second opinion for a clinical trial? In those cases, what's also helpful is for me to know if they have like a family or people they can stay with in certain cities. Because oftentimes if they are serious about going somewhere for relocating for treatment, I don't want to give them a referral to a city that's not really realistic for them to go more than once, for example. So if I know, again, if I know a bit more about them, I can try to, I might have, referral to Dr. Bhatia, Dr. Mendes, and Dr. Thomas, and they're all in different, Dr. Thomas is in Vermont, Dr. Bhatia is in Wisconsin, Dr. Mendes is in Utah, and I feel, they're equally great and who to send them to. I think knowing where the patient might want to go more than once also help. So I think it's just, you know, letting your doctor know you. You can, break the ice by asking about the doctor as well. I think you can probably see a lot of us are pretty frank. I had a patient, I actually from my prior institution who had a notebook and she asked the same question to all the doctors every time. She had a one question each visit. What music is your favorite? She used to kind of throw me off. I'm like, I don't know my favorite music. And so just silly things like that. Just get to know your doctor and let them get to know you.
And I'll just add one thing is that, there are some patients who would like to keep second opinions private and kind of go about it and navigate that on their own. It is a fair bit of work to navigate getting a consultation in a new institution. And so if you are comfortable involving your current neuro-oncologist in that second opinion referral process, chances are your treatment team can save you a whole lot of work in record transfer and getting your slides and images transferred. And it is very unlikely that you're going to offend anybody by asking for that second opinion. In this field, it is totally expected for patients to pursue second opinion.
Yeah. And maybe just limit it to like two or three though, because then you get choice paralysis. Don't go to like 5, 10 places. That just becomes too overwhelming.
Thank you. Our next question is specifically for those patients who live in a more remote area and might not live close to like an NCI designated treatment center. There was just concern like, is this a reputable place for me to go to? Any thoughts about just the differences between the different treatment centers?
Yes. So there there's a whole host of different treatment centers out there. And there are NCI designated cancer centers, which are ones that have been recognized by the National Cancer Institute with funding, so with a grant that helps support some of their research. And then there are other cancer centers that are not NCI designated, but call themselves cancer centers because they have comprehensive cancer care. They have surgeons, oncologists, infusion centers, imaging, and can kind of do everything in one place. And then there are a lot of community hospitals that may be able to do elements of the treatment, but may not be able to do everything. And so I think with a disease like glioblastoma, which is relatively rare, it can be very helpful to get at least one consultation from a neuro-oncologist with a lot of experience in this disease. But it is also very common to partner in a way that makes this logistically feasible, right? So I treat patients who live in a very remote area, and I will often have people come to me and we lay out the treatment plan. And if there's an oncologist in the community who can do that, who can monitor and prescribe the chemotherapy, order MRI scans, I always say to the patient, like, I'm happy to follow up with you however you want. Come back to me if you have a change in the treatment, come back to me if there's a question along the way. But time is precious, and there is uh, a real limitation to how much you can travel and how much that takes away from your day-to-day life. And so finding that balance of what can be supported at home in a safe way, and then supported by people who have expertise in this field, who sort of gone over the treatment and plan and said, yes, this is a reasonable thing for you to be doing.
I would say a quick tip on figuring out who to see as a second opinion if you are just Googling physicians. Um, because sometimes it's hard to see like who's listed and then what they offer. Finding a doctor, just like whenever I move, finding a primary care doctor, it's just so cumbersome. So a quick tip is if you look at the doctor's bio and you can usually see where they have trained. We don't really care about where they went to med school, whatever, but if you see that someone is board certified in neuro-oncology, or if you see that someone has done fellowship in neuro-oncology, the likelihoods are that those physicians have expertise in brain tumor like glioblastoma.
Thank you. And I think an add on to that, we just got a question that came in that if there is not a neuro-oncologist in their area, what is the second best option to seek out?
Sure. There are a lot of medical oncologists who treat brain tumors, and I think you can get great care from medical oncologists. And I think it is fair to ask somebody or ask their hospital or their team, how often do you see glioblastoma in your practice, right? Because if it's somebody who does primarily lung cancer and sees one person with glioblastoma every 5 years, that might not be the best fit. But if it's somebody where that's a big chunk of their practice and they see other cancers as well, you may be able to get excellent care from a person with medical oncology training.
And with that said, sometimes may not have an option, so I I practice and live in the fifth largest metropolis in the United States. However, my surrounding areas are not necessarily the same. I have patients in Indian reserves, and I have patients there are patients in places like Nevada, Nebraska, South Dakota. There are New Mexico, where there's actually not actually any board certified neuro-oncologists if you were to look on the board certification website. And so they may not have a choice to see a neuro-oncologist, even if they're willing to travel a couple hours by car. If you are able to financially and also physically and just feasible to go travel to somewhere you can go one time, even getting plugged in one time with a neuro-oncologist of your choosing at a place can open the doors for better, more informed phone calls to help with your local physicians over time. And I think all of us have done that, just stay, not officially involved over time, but once you meet someone one time, you have established care. So you can have more opportunities and allowabilities to interact with your local physician. So that's also an option.
Great, thank you. Okay, this last question is a bit multi-layered. So we had somebody ask about like a central database for potential treatments. And they didn't specifically allude to clinical trials, but just a plug for ABTA, we just launched our clinical trial finder. You can obviously go to clinicaltrials.gov. You can connect with the Brain Tumor Network to help find some treatments. But really, this patient was expressing kind of a pain point, like my doctor didn't share all these possible treatments for me. And I feel like I'm always going to my doctor with these ideas. Can you explain like maybe like why this happens sometimes, and are doctors referring to a database of treatment that they should be using, and can this be accessed by patients?
Yeah, it's a really good question. So there are a few resources that physicians often refer to for standard of care guidelines. And the things that are considered standard of care are things that have been reviewed and approved by the FDA and that have completed review in clinical trials that show that there is some sort of benefit of that treatment. And then these guidelines are generally reviewed by large practice groups. So the American Society for Clinical Oncology, the Society for Neuro-Oncology, they have a combined guideline for treatment for newly diagnosed and recurrent glioblastoma. And then there's an organization called the National Comprehensive Cancer Network, or the NCCN, that also publishes guidelines for care. These guidelines are very much written for the physician in mind. And there are kind of distilled versions of these guidelines that there are some reputable websites where you can as a patient access and see what they are. The ABTA has really good information. The NCI has really good information through the National Institutes of Health and the National Brain Tumor Foundation. I think these are all places where you can get pretty reliable information. And then, as Dr. Mendez alluded to earlier, there's another website called clinicaltrials.gov, and that has the non-standard treatments. That's a registry for every clinical trial that's being conducted in the United States and many of the international trials as well. But any US physician conducting a trial is required to register there. I think coming to something like this is awesome, right? These kinds of communities and discussions are ways to really hear this information in a way that is intended for an audience of patients and caregivers. So hopefully it's very digestible